Hello everybody, Dr. Shadi Rafich here with another video to help educate everybody on some basic medical principles and to also give an update on our good friend Joel Doherty, who is still recovering from COVID, which has obviously ravaged his body, but he's alive, he's here with us today, and so he's on the road to recovery. This video is going to be focusing on being jaundice or icteric, which is a term that maybe some of you have heard before, and we're going to go over it in more detail now. Obviously, it's a very complex topic, and we're going to try and condense it and make it as simple as possible. So, Ictrus is basically when there's a high level of a toxin in the body called bilirubin, and when it becomes sufficiently elevated enough to cause discoloration of the skin, of the eyes, of the internal organs, you end up calling it jaundice. But for the most part, practically speaking, icterus and jaundice are used interchangeably to mean the same things. What causes icterus or jaundice is an increase in a toxin called bilirubin. So in your bloodstream, if the bilirubin is high, it's called hyperbilirubinemia. Now, what's the point of bilirubin? Why would the body have such a compound? Well, the normal lifespan of a red blood cell is about 120 days. And when a red blood cell dies, when it becomes senescent, meaning it's old, it's no longer deformable, it can't fit through blood vessels anymore, it's aged, then the body has to take care of it. And when it does that, it ends up recycling it. And out of its many components, the main component that comes out of that, and for the purpose of our discussion, is bilirubin. So the red blood cell gets old or gets destroyed for some reason, either through normal bodily process, or through age-related reasons. And bilirubin is extracted from the broken down red blood cell from the heme, which is the compound that allows red blood cells to hold on to oxygen. And the bilirubin then goes through normal processing. What's supposed to happen when you have breakdown in red blood cells, which again happens all the time, it's a normal process, is the bilirubin itself should go to from the red blood cells that's destroyed into the liver, the hepatic system. From there, the liver will process it through a variety of steps that we're not going to touch. But basically, 90% of what is bilirubin ends up being in the feces. So it goes through the intestinal tract. That's actually what creates the brown color to stool. So if you've ever had a situation where the feces is not colored normally, either it's just something that you ate or you may be having an underlying problem. You're welcome. So 90% of the bilirubin gets processed that way. The other 10% goes back into the portal circulation. It's what's called enterohepatic circulation. So basically goes from the liver to the biliary system to the small intestine. Instead of going into the poop, that 10% goes back into the bloodstream, goes back to the liver, and it goes enterohepatic circulation. Then there's a very small percentage, even though we just described 100% of bilirubin, there is a small percentage that actually does go to the kidneys and gets excreted through the urine. But it's a very small amount. So that's what normally happens. That's a normal process. That does not cause icterus or jaundice. What causes icterus or jaundice is when you have either one of three things happen. One of three things. And this is the way that medical students, veterinary students, and folks who are listening to this video should be thinking about what icterus means. Three reasons for it. Three reasons for icterus or jaundice. We divide it into prehepatic causes of hyperbilirubinemia, hepatic causes of hyperbilirubinemia, and posthepatic causes of hyperbilirubinemia. Hyperbilirubinemia, hyper meaning increased bilirubin, and emia in the blood. That's elevated bilirubin levels. I don't really recognize a condition where you have the opposite happen, where you have hypobilirubinemia. That's not a thing that I think exists. So prehepatic, hepatic, and posthepatic. What are the different reasons for those three categories? Prehepatic. The most common reason for that is excessive red blood cell destruction. So if you have a disease like a cancer that's tearing up red blood cells, you'll have an increase in premature red blood cell death. Or if you have an immune disease that's attacking red blood cells like IMHA, immune-mediated hemolytic anemia, then you'll have an increase in red blood cell destruction. That's prehepatic. Anything that happens before the liver, meaning an excessive bilirubin production, most commonly manifested as an increase in red blood cell destruction. Hepatic causes. If you have an abnormal liver, you've got cirrhosis, you've got liver cancer, whatever it is, then bilirubin will then back up. It can't be metabolized normally, the normal way it should. It'll back up into the system and cause a hepatic reason for hyperbilirubinemia. And that probably is what Joel is dealing with right now. He he's got currently, based on liver biopsies, most recently some scarring of the liver. And because you have scarring of the liver, the sinusoids, which are the small channels that process bile, which bilirubin is part of that, get backed up, and then you end up with a hepatic reason for the hyperbilirubinemia. Third cause, posthepatic. Anything that happens after the liver that usually pertains to the bile ducts. So if there's a blockage in the bile ducts, let's say you have a gallbladder stone, let's say you have pancreatitis, inflammation of the pancreas, which typically shares its anatomy with the bile duct. If you have any reason why there's a blockage of the biliary tract or the bile ducts, you'll end up with a backflow of bilirubin, and you'll get posthepatic hyperbilirubinemia. And Joel may have some of this as well. It's hard to say. There are conditions that are called Cholestasis of Sepsis that we see in animals, and I think it's recognized in people, where cholestasis is chole being referred to the biliary tract, stasis being static, not moving. And if you have history of sepsis, which he did, you can have a condition that results in sludging of the biliary movement in the bile tract, and then you have posthepatic hyperbilirubinemia. So three causes, pre-hepatic, hepatic, posthepatic. And those are it. Those are the three categories. So it shouldn't seem like a confusing premise, because when you break it down that way, now you know fundamentally what causes each one of those categories of high bilirubin in the body, and therefore jaundice and icterus. So I hope this video helps you out. Obviously, prognosis and treatment differs widely depending on what causes the hyperbilirubinemia. And of course, you can have multiple reasons for high bilirubin in the body as well. So it may not be just one thing, although most commonly it is, but it can be multiple factors. And so in the case of Joel, he is right now jaundice or icteric. He's undergoing treatment for this, and it'll be a while before, of course, he recovers. He may end up needing a liver transplant at some point in the future. He's going to be susceptible to many different things, everything from infection to toxin buildup to poor metabolism of drugs. It's going to be coagulopathies, bleeding disorders. So, of course, it's going to be a continuation of his already wild ride. But again, he's with us today. Please visit the Facebook page for find his GoFundMe. It's still going strong. Thank you for everybody who's donated. Super helpful. He needs the funds. He needs it. He's a long way from being anywhere close to normal. So, but he's doing great. He's holding strong, and we're very proud of him and his family for staying with it and just trying the best they can to get through a difficult time. So, GoFundMe, Joel Doherty, #BreatheJoelBreathe. I hope this video increased your understanding of a fundamental aspect of medical pathology, and we'll see you in the next one. Take care.